Now here's Make It Happen with Keith Sales Pro.
How do highly successful people think? According to author Tom Black, a boxcar millionaire, here are 5 beliefs. Successful people believe that people are as happy as they want to be. Successful people always are persistent, even in the face of disappointment. Successful people believe you must constantly improve your knowledge and skills. Successful people believe big, even when dealing with small-minded people. And finally, successful people believe you must be truly committed to being of service to others. Today, remember, it can happen. It will happen. And together, we will make it happen.
Follow Keith Sales Pro on Facebook or Twitter at Keith Sales Pro, or visit his website at keithsalespro.com.
It can happen. It will happen. And together, we will make it happen.
From Rare Gym Productions, this is your Monday morning meeting. Monday morning meeting where we take time to discuss, to get to know a little better, to explore, and to dive deeper. In our morning meeting, we're going to take some time to get to know MEDIPLEX home care professionals.
Someone asked me a question the other day, although you're not doing direct nursing care anymore, how are you still impacting the patient? And I told them, because we're always talking to our nurses about compassion, about taking care of someone, being good to that person. Remember that person needs you. I'm always talking about that and reminding them that's what we actually came in healthcare for. That's right. And that's the business that we should be about.
We go out, we take care of patients in a different way. You know, you sit with them, you help clean their house, you run errands. It's a beautiful service. But at the same time, now we've also won them over. If we've done a good job, they believe in us.
Getting to know the business that's caring for you with founder and CEO Glenda White and Chief Operating Officer Tawana Spann. We'll be right back. I'm Jade Harrell.
If you or a loved one are discharged from the hospital and need help, call on MEDIPLEX Home Care and Hospice. With our comprehensive home health services, our professional and caring nurses and therapists will come to your home, assess your medical needs, and work with your doctor to design a plan of care. MEDIPLEX is a Medicare certified agency, which means that Medicare will pay for your home health care needs. Remember that you have a choice in home health care. Let your doctor know that you choose MEDIPLEX Home Care and Hospice.
Welcome to the 2014 MoCan Business Symposium, bridging rhetoric to reality. Coming to the St. Louis metropolitan area on Thursday, May 8th and Friday, May 9th. This symposium will provide business development and partnership opportunities for small and large businesses. This event will bring together public and private industry stakeholders focused on providing small businesses with vital connections to local leaders and decision makers in their industries. Discussion topics include using technology to grow your business, how to win with gaming, public sector partnering, breaking into the biosciences industry, getting healthy with healthcare, bonding and gaining access to capital, connecting to general contractors, certifications, why have them, and when's the best time to get them. We will hold this event at the Union Station Hotel in downtown St. Louis. We welcome your participation in this event, and we look forward to this collective opportunity. Need quality care and support for your loved ones with illness? Want them to live as fully, independently, and comfortably as possible? Well, come on in and get to know MEDIPLEX Healthcare Professionals. It's MEDIPLEX Mondays with Rare Gym Productions, proudly presenting, promoting, and producing positive programs. I am excited to bring forth and to share MEDIPLEX Mondays. We are going to take some time to get to know in depth, more so, MEDIPLEX and all its amazing offerings for us in the community. I'm really pleased to be able to focus on community partner. I am joined this morning by the team, the leadership team, and good morning to you both.
Good morning.
Yes.
Good morning, Jade. How are you?
I am doing fantastic. I feel fantastic today, but there is a whole lot more to healthcare that we need to understand. So we're turning to you all as our experts. Healthcare professionals is a part of your name. So kind of paint the picture for us and help us understand what you do at MEDIPLEX as your base business and what we really need to understand that goes into this aspect of healthcare.
What we do at MEDIPLEX, we're an extension of the hospital or your physician office or an extended care facility. Anyone that has an illness, We work with people in the community, primarily 65 and older, and then anyone that has health care insurance, primary Medicare clients. We do work with private insurances as well, United Healthcare, Blue Cross Blue Shield, Humana, Mercy. Tawana, you can chime in at any time.
Okay, Humana, like you said, Humana, UHC.
UHC, United Healthcare, and their products. And what we actually do, we have the nurses and the therapists that go out into the home and take care of the patient as an extension of their doctor's care, of extension of hospital care. And we attempt to educate. Well, we do educate. We educate them on their disease process. We educate them on wellness and prevention. We educate them on how to remain in the home. We educate them on their diet and their disease. We take care of anybody with wounds and trachs, any type of procedures. And the name actually stems from, professionals. We're all governed by a professional license. So we have the registered nurses, LPNs, the physical therapists, occupational therapists, and speech therapists.
Describe to me when we would call MEDIPLEX and what you would do in response to that call.
Okay, great question. MEDIPLEX, first of all, like she said, we come to your home. Patients would have an issue. Maybe they've been to the hospital. Maybe they've called their doctor and identified something that's going wrong. Be it that they're having pain or they don't know how to take their medications or there's a new disease that they're not sure how to manage. The doctor would then call us or the patients can call us directly also. And then we go out and we take care of them.
Mm-hmm. Now, are these folks that are typically immobile and that are limited to their home, or is it also a convenience?
You have to be homebound.
Homebound.
So,
that's
but
the proper.
That's a general term, though. Medicare has left that term very broad in its definition. It means basically that it's hard to access the community. You're at home. It doesn't mean you never leave. It just means that it's taxing. They use the word taxing. They use the phrase taxing effort. So to do it, it takes a lot out of you. And we all have relatives that, they can get out, but when they're back home, they're wiped out for the rest of the day. Or it increases their pain so much that now they can't enjoy the rest of their day.
And that's what we would include also in homebound?
Yes.
All right. And so we would be homebound, but we would also have some sort of insurance coverage that would allow us that benefit to have home care health professionals come to our home.
Yes.
And that's what you specialize in.
Yes, that's what we specialize.
Help me understand how this came to be your business. You may have cared for people. You may have even been in the medical field.
Well,
but how did you decide? Because I'm talking to the top here. This is you all's business.
I guess I would say if I wasn't a school teacher, if I wasn't a nurse, I probably would be a school teacher. If I wasn't a school teacher, I probably would be a social worker. And I think I have an innate ability to want to help people. So MEDIPLEX came out of the fact that statistically they talked about that the aging population years ago would be the group that we would need to provide care for.
Largest population.
Your buttons.
Right. That we would need to, the elderly population or the older population we would need to provide care for. So I stated that's the business I wanted to be in. I've always believed in statistics. I was one of those in school, one of those math geeks. So I believed in statistics. So I said, statistically, I want to be in a business whereby I'm taking care of somebody, and statistically just want to be in an arena where there was going to be a need, and not just a need, a growing need.
A growing need. See, that was a business decision because we've got plenty of teachers. We've got plenty of servant heart people, but that was sharp. You turned right. That was a real business move. So I'm believing that you had that sense of savvy as well. Tell me more about how the business has grown since it started. How long have you all been in business? How long have you been doing this?
Well, we've actually been in business since 1999. Been in business since 1999. And the business actually started out of my basement.
Really?
So, yes, it started out of my basement with New Beginnings in Home Services, which is some of my baby. We started out of the basement, and I knew of a partnership that they were deciding to, separate. Oh, that's a big question. I had some business partners at first. We separated. Now, I've actually been transitioning for years. I decided to open MEDIPLEX. I had New Beginnings. Our partners separated. One took a skill agency, and I took New Beginnings. And I decided to open a skill agency as well, and I opened up MEDIPLEX.
She's being modest. She's being very modest. She's savvy. It was a logical transition. She had a captive audience. She had done a very good job with developing a company, like she said, called New Beginnings, which is a service that we go out to the home, but it's the unskilled side of it. We go out, we take care of patients in a different way. You sit with them, you help clean their house, you run errands. It's a beautiful service, but at the same time, now we've also won them over. If we've done a good job, they believe in us. So we end up being in a position where they're also looking to us for the next step advice. And just in her vision, she was able to say, well, I have this audience of people who are trusting me to advise them, take care of them. I'm in their homes already. Why not now take the next step and offer the skilled service? Because inevitably, they're going to need a nurse, a therapist. They're going to have some issues. They're going to go to the hospital. So why not offer that also? And that's where it came from.
Well, with such a vital service and so personal, the need for trust is there. It has to be there. And many times a family doesn't know enough about any business or organization to know if they can trust them. Now, with familiarity, that grows, but, looking up a name in a phone book or, maybe other than word of mouth, you don't really know who you're dealing with. And to offer that as another service is definitely a benefit to the patient or client, rather, but also very insightful on your part. Tawana, tell me about your role there at MEDIPLEX and how you came to be a part of the team.
But let me comment on that. The intimacy of it. Yeah, because, you made a great point. Right.
I'm in a room full of savvy. Don't bring it.
Okay, here I come. No, it's an intimate thing, though. I can imagine, especially as African Americans, we don't like a lot of people in our houses. We never have. We're distrusting because of the history of healthcare. We don't want to take it back to, the ski experiment and all that. We don't want to do all that. Right. But we don't trust, and so it's vulnerable. So to have someone and to say, I need help and I need you to come to my house. I need you to be exposed to my environment. I need to be that open with you that you come and interact with my intimate space. I don't want everybody doing it. And I need to have somebody who I already trust and who's going to vouch for him come. So how I got involved with MEDIPLEX now, I go to your question.
This is good.
How I got involved, I had a pretty extensive career as a therapist in hospitals and inpatients. I had worked in pretty much every aspect of a hospital, things I love doing. I was in the ICU, the ER, neuro floors, burn units. And I kind of gotten tired of being not therapist in the hospital, but the African-American therapist who probably was a little bit too proud, I guess, who probably knew a little bit too much and felt a little too good about herself.
Shame on you.
Honestly.
What were you thinking?
Honestly, therapists in the healthcare environment, when you get into the big corporate parts, like I've been at the big, and we don't have to name names, the big hospitals, it's not a lot of us in management in those environments. So I just got to a point of being a little burnt out and feeling dismayed. And I just looked around. I had taken a break, and I don't know, I guess God led me because I'd taken a break. And I got a call. I don't even know where it came from. I don't know. Maybe I had my resume out there.
We had an HR manager at that time that called you.
Okay.
For a full-time therapist. And
it was hilarious because I said, well, let me go. So I've never heard of this company. Let me go see what they're about. I don't know. They were looking for someone to run the therapy department. And I got this email. It wasn't on even any letterhead. And it said, have you thought about home health care? And I said, I'm not opposed to it. And I went to the interview and I met this little loud woman sitting there who turned around and looked at me like, what? I guess she knew that she had an interview today, but you didn't know it was going to be me.
No, I did. Yeah. I'm known to be loud around the office.
Yeah, that's okay.
But I'm sweet.
Yes, I believe it. I believe it.
And she hopped up out from behind the desk and said, come on, let me go talk to you. And there it was. I don't know. Sitting down in Clayton.
You that there was a future there for you?
I was ready for something very different than what I had been doing. And meeting Glenda, I had not had that experience before in healthcare. And so it was refreshing for me. It was new and it felt challenging and it felt like something that I could do. So I don't know. That's I guess nice. There was a marriage there. I don't know.
And what experience are you referring to, Tawana? It was a new experience. What experience was that?
I'm the interviewer.
I'm so sorry. I don't want to steal your thunder. I'm known for taking over.
Yeah, she is.
No, but what you're saying to me, though, Glenda, you have success. Here we are today focusing on this company and your services and your commitment. What is it that is making you so successful?
I think it's my team. I have a business degree. I tried to model my team like a business model. I can't do it by myself. I tried. For many years, I was out there doing it by myself. But I knew I had to have people in place that would run certain departments. So I set the entity up where I had direct reports, people reporting to me. And that's what I did. And I've actually had direct reports for quite some time. Although I've always operated as a small business, in actuality, we use the larger companies' business models in order to take our business to the next level. Because if you operate like a mom and pop, you're going to be a mom and pop. And if we have different people in different positions, we expect them to do those jobs. And we support them with those jobs that they do. Anything that they need, we try to support them. Even with our nursing staff and our therapy staff, both of us have an open door policy, Tawana and myself, and we constantly in servicing and talking to the staff and letting the staff know our vision for the company and being compassionate with taking care of the patient. Someone asked me a question the other day, although you're not doing direct nursing care anymore, how are you still impacting the patient? And I told them, because we're always talking to our nurses about compassion, about taking care of someone, being good to that person. Remember that person needs you. We're constantly having those speaks. I guess I'm a motivational speaker. Is that what I am?
Very good.
I would say that.
I'm always talking about that and reminding them that's what we actually came in healthcare for.
That's right.
And that's the business that we should be about.
For your patients and for those that need to be your patients, what is the invitation today to try MEDIPLEX?
Pick up the phone, call us. We do everything with a physician order. So we contact your physician. We don't do anything alone. We have to talk to your physician. Just give us a try and not tell anyone that I'm out in the community and I'm talking to people. Give us a try and just see if we don't do our best. And if we don't do our best, you can always come in. You can call us, voice agreements, and then we'll look into it and then we'll follow back up and get back with you. But we actually, I think we got a great group of nurses and also a great group of therapists. And I think they will give you 100%.
Tawana?
We strive for excellence. Our desire is to be the best at what we do. We want to take care of you. We care. We want you to be better for having had an experience with us. And that's it.
That means a tremendous amount. And for the record, I don't care what anyone would pay. I would not do an interview like this or a profile like this if I didn't believe so too. So I'm very excited to get to know you guys better this month and to share what I discover with our listeners. It's MEDIPLEX Monday, y'all. Let's get healthy. MEDIPLEX Healthcare Professionals, LLC, strives to provide quality care and service with you in mind. Since 2002, their business is caring for you. They have skilled home health services in nursing care, physical therapy, speech therapy, occupational therapy, home health aid services, and medical social services. With 2 locations in St. Louis and Swansea. For questions and referrals, call 314-993-5580 in Missouri or 618-222-6778 in Illinois. Visit them on the web at MEDIPLEXHHC.com. This is your Monday morning meeting with Jade Harrell, another positive production of Rare Gym Productions, proudly presenting, promoting, and producing positive programs. Learn more at oneraregem.com. That's ONERAREGEM.com. Thanks for listening.